Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. As an elite level runner and coach, I'm excited to introduce you to the All In Running Club. The All In Running Club exists to help you become a better runner. Whether you're a beginner, an elite runner, or anywhere in between, the mission of the All In Running Club is to give you the tools you need to find your success in running. Join today to take advantage of the 75% off yearly membership rate offer. Click the link below in the show notes to learn more. So thank you, Dr. Clarke, for being a guest on the Confidence Through Health podcast.
Delighted to be with you, Jerry.
So we want to talk about chronic pain and really it's psychophysiologic disorders, which I'd never heard that like phrasing until I received your information and started looking up, what you've been doing. And like, first off, like, why did you get passionate about this? What drove you into this area to help people in this way?
Well, I wasn't supposed to wind up in this area. I was supposed to be a garden variety gastrointestinal specialist, and things were going well in my training years. I won an award for diagnostic excellence in medical school. I was passing all my board exams with good scores. I was in a top training program. I was over 7 years into my formal training. So I really wasn't prepared to run into a patient I didn't know the first thing about diagnosing, but that's exactly what happened. Is a patient referred from another university to UCLA where I was in training because they couldn't figure out what was wrong with her. And we did some very specialized testing. And my department chairman and I were convinced that this test was going to show this woman's problem because, frankly, we didn't think anything else was possible. But then when that test was normal as well, we were just thoroughly perplexed, and we were left with just telling this patient she was going to have to live with her condition. But I delved into stress a little bit with her just to make conversation than anything else, because every other doctor who had seen her asked her about stress, and she didn't have any. She was happily married. She had 2 kids. She enjoyed her job. There wasn't anything there. But then I asked her about, well, what about stress earlier, thinking, she'd been ill for 2 years and thinking maybe something had happened right at the beginning of her illness. And she interpreted my question to mean the more remote past and told me that her father had molested her. And I had no training in how to respond to something like that. I had never heard anything like that from a patient before, didn't know what to do with it, didn't think it could possibly be related to her illness, but fell back on my earliest training, asked her about, exactly what had happened. It turned out to be a very severe sexual abuse story that she had. And to make a long story short, I found a psychiatrist at UCLA who had an interest in mind and body issues, not thinking that it would amount to anything. But when I ran into the psychiatrist in an elevator a few months later, I was shocked to learn that the patient was cured. She had a really severe illness. And the fact that you could alleviate that just by talking to somebody, here I was in my 8th year of formal training. Nobody had ever mentioned that such a thing was possible. So it kind of opened my imagination to a new way of thinking. And I thought, if I'm going to be a complete doctor, I should learn a little bit about how to do this. So I had Dr. Kaplan teach me her framework for how she thought about these things, thinking maybe it would come in handy for a few patients a year. Well, wrong again. It turned out to be 5 or 6 patients a week. It turned out when I was in private practice in Portland by that time. And I would send them off to the mental health people, and the patients would get what is called cognitive behavioral therapy, which is, the most widely available dominant form of psychotherapy out there. Turns out not to be good enough for people with this condition. And many of them would come back to my office and say, I'm not any better. And so I would say, well, I have a few basic ideas about what might help. I will try them.
Mm-hmm.
And they started to work. People started to get better. But it's still, even with 250, 300 patients a year, it took me 4 or 5 years to climb that learning curve and
Right.
reach a decent level of proficiency.
Right.
But a year after that, I got the Doctor of the Year award from a very big HMO that I was working for at that time. So I was clearly onto something, and I've been
Right.
using it ever since for 40 years now, over 7,000 patients. And it's just remarkable how severe of situations can be turned around using these techniques.
Right. And so that's amazing that she was able to one, be able to be comfortable enough to share with you, like, and to think that was where she was going with it. But is that like, are those experiences that happen early on in life that potentially lead to chronic issues later? Is that what the deep stress term is?
Yes, it's stresses that people don't recognize. When I talk in terms of deep stress that people are struggling with,
Mm-hmm.
it is forms of stress that people are not fully recognizing, and the majority of those can be traced back to when a person was a child. What we call adverse childhood experiences, or ACEs, and these amount to pretty much anything you wouldn't want a child of your own to experience. And they have as a common denominator that they adversely impact your self-esteem. They make you feel like a second-rate human being, or like a worthless piece of crap in many cases, for example. And they have impacts on many other personality traits that are stressful for people in the present day. They can lead to what we call triggers, which are people, events, or situations that are happening today that are linked to the adversity in the past. And they can lead to powerful emotions that are repressed, that people are not consciously aware of, that can manifest in your body.
Right. And so, and those deep stresses are not just like the patient you referred to, it was a sexual contact issue, but it doesn't have to be of sexual nature. Like you said, it's just something that was traumatic to you that caused an issue with your self-esteem. So it could be in any area of life.
Yes, absolutely. It can be just simply not getting enough emotional support, affection, being loved.
Right. So sometimes it's not even necessarily like, it's not even necessarily like an instance that you can go back to. It may be just a compounding of not getting enough over time, that you just start repressing yourself, and it just piles up.
That's right. It can be fairly subtle. One of my patients was he was born 11 years after his next oldest sibling. He was clearly not a wanted child, and his parents, excuse me, his parents treated him that way all the years he was growing up. It's like, we don't really want you around. It was really harmful to his self-belief. Another patient told me that the only time he got praise or support from his parents was when he did something better than his brothers and sisters could do it. And he had 3 siblings who were, very accomplished kids. I mean, in terms of their social abilities, academics, extracurriculars, they were very capable children. So it wasn't easy for him to stand out. And consequently, he was largely ignored in terms of, being made to feel good about himself. And that had significant long-term impacts.
Right. And so is that it to me, it's showing there's definitely a connection between your emotional health and your physical health down the road.
Yes, very definitely. I mean, anybody who's ever just as simple as blushing with embarrassment has had a brain to body reaction. Or if you've felt say you're in competition and you've got a big race coming up, and you're at the starting line and you're starting to get that feeling of tension in your stomach, a little knot in there, or some butterflies, we call them.
Right.
That is a brain to body reaction. And this form of illness is just a more severe and long lasting form of that very common human experience.
And so is that something that in today's modern medicine, the way that it's structured, and it insurance companies have a very detailed, you have this much time with this patient, da 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 da. Like, is that something that's like being missed as far as like being able to dig into that emotional background with primary care physicians?
Very sadly so. I mean, most physicians, myself included, until year number 8, are not formally trained in how to evaluate people with this condition. And there's, when I teach doctors, I teach a systematic process for making sure you don't miss any of these issues. It does take a certain amount of time, but these are patients whose illness can go on for years. So if you just get a little bit of this information at each one of your 15-minute doctor office visits, talking about the physician now gathering this information, you can build up a pretty complete picture of the stresses that the patient is coping with, whether it's stress in the present day. One of my patients was suffering domestic violence from the person she was living with, her partner. And that violence had been going on for exactly the same length of time as her otherwise unexplained physical illness. So as soon as that issue was uncovered, we were able to successfully deal with it, and her illness went away. But we haven't trained our healthcare professionals to look for these things. The brain is what is generating these symptoms. And the reason the brain is doing this is because of stress, either in the past or in the present. And the good news is, if we can identify what those stresses are, we can almost always do something about it. I've had patients who've been ill for decades, and when the stress is identified, they get better.
And so it's and the patients have to deal with potentially physicians, but definitely their friends or family that are telling them, you're not really sick. It's all in your head. Just get over it. Everybody's got to deal with life. Just get up and move on with the day. But that doesn't help anybody.
Or, another idea is, what's the matter with you? Can't you handle your stress? And that's all, everything you just said and what I just said is completely false. It turns out that the stress can actually physically alter the nerve circuits in your brain. We have a tool called a functional magnetic resonance imager. It has been used to study the brain in people with these conditions and these symptoms, and the brains are physically different. So my response to somebody who says, is this all in my head, is no, it's all in your brain. That the brain is the circuits that are processing signals from your body are actually different. And we even have a couple of studies now that show that when the person is given appropriate treatment, the brain circuits can go back to a healthy pattern. So we can physically change it back just by talking to people and giving them the right exercises to do. So that's why my colleagues and I like to use the term psychophysiologic. It's a term that's a blend of psychology and physiology. Psychology are the processes of the mind. Physiology are the processes of the body, and they're completely connected.
And so is this from a treatment standpoint, when somebody comes in with symptoms, to go back to the physician that only has 15 minutes, and especially if you're seeing somebody who is not your normal doctor, but you're seeing somebody in their group who doesn't really know you, and they throw a prescription at you because they're trying to make the symptom go away. Is that part of what's causing the opioid issue of just overprescribing medications?
Yeah, that's a big part of it. The physicians are trained to look for a disease or an injury that is responsible for the symptoms. They are looking at, if you have symptoms in a particular part of your body, it can be anywhere from head to toe, but let's take low back pain as an example because it's so commonly psychophysiologic. The physician is going to focus on your low back, your lumbar spine. And if you've got pain there, they may be prescribing opioids to alleviate your pain, or at least they certainly did in the past when there was a big push by pharmaceutical companies to treat pain that way. And it has obviously led to enormous problems with opioid overdoses. There were 110,000 drug overdoses in the United States alone in 2022. And it's because people are not recognizing that a large fraction of chronic pain, probably well over half, is generated by the brain. And the brain is doing this because of stress. And we need to investigate the patient's life, past and present, for sources of those stress. And when we do that, we don't need opioids. We can treat the stresses. And that turns out to be very, very effective. One of my patients was a 17-year-old girl. I was asked to see her on her 70th day in the hospital. She had unexplained abdominal pain for the last 18 months. She had seen 6 other specialists, and I was number 7. She was getting morphine around the clock at a dose of 10 milligrams an hour. For someone her size, about 100, 110 pounds, 5 milligrams of morphine would be enough to alleviate the pain of a fractured leg. She was getting 10 milligrams every hour. And nobody could find anything wrong with her. So I began investigating for sources of stress. And it wasn't easy to find. It took me a while, but I did find it. Was able to successfully intervene. She weaned herself off of the morphine in a week and went home. She was taking opioid tablets, but she weaned herself off of those 3 weeks after that, completely pain-free. Again, just by finding the stress in her life and dealing with it successfully.
Right. And that's like that stress piece. And I think we all know that, just on maybe not the deep stress level, but on the, I've got a lot of stress at work this week. And so I need to do something to alleviate that stress, whether it's, I'm going to get extra sleep because that's going to help me recover. I'm going to go exercise. I'm going to do something that, like you said, it's going to intervene and cut that down. But when it's so deep in, repressed and it's really hard to find that on your own, isn't it?
It can be, although on the endchronicpain.org website, we have a 12-item self-assessment questionnaire that can give people a lot of insight. It's set up in a way that the more questions to which you answer yes, the more likely it is that you have a psychophysiologic explanation for your symptoms. So we've chosen those questions very carefully to try to give people insight. It won't capture everything. It won't give you insight into every single possibility, but it'll go a long way toward helping you get started on understanding this. A good example that you made me think of for someone who's under stress in the present day is someone who is the kind of person who takes care of everybody else in their world. I mean, they're taking care of their spouse, their kids, their people in their workplace, their neighbors, their family, and yet they have real difficulty putting themselves on the list of people they take care of. And it turns out that, that's a personality trait that can be really hard to change because it is usually linked to the past. And until you understand that link, it can be very difficult to change that. But most of my patients with that issue, and there were a lot of them over the years, they grew up in environments where they didn't get sufficient opportunities to play as children. And if we don't get to play as children, we don't really have a good sense of how to play as an adult, how to do something that has no purpose but our own joy. And if we can see those connections, then it's easier to make changes, easier to carve out some time where we just do something for ourselves. And that turns out to be an essential human skill. If you don't know how to do that, you're living as if on a treadmill you never step off.
Right. And that's a huge piece for everybody to understand, is that like that downtime is it's important. Like, and to go on a vacation and come back and say, I need a vacation from my vacation, like that should be a huge signal that there's big triggers going off in your life.
Yes, I completely agree with you. There's a story about vacations that I love to share. It was a man in his 70s who had had back pain for over 25 years every single day, except when he was on vacation. And for him, it was a real vacation. He didn't need a vacation from his vacation. It was real. He went fly fishing in British Columbia. Nice. Now, when you're fly fishing, you're moving around out there. You know, you're casting the rod, you're netting the fish, you're putting some bait on your hook, you're moving around the stream, you're walking up and down the current. It's all the kind of biomechanical movements that should have been just as stressful to his back as anything else. But his back was fine. He didn't have a twinge the whole time he was up there. And so I'm getting very suspicious that this has got to be stress related, because if he's not having this pain when he's on vacation, it's not a biomechanical issue in his back. And just as I'm starting to reach that conclusion, he tells me that when he's done fishing for the day, he helps the lodge owner clear brush from behind the lodge.
Oh my gosh.
If you've got daily back pain,
you're not doing that.
That's going to do it. And he said, nope, felt absolutely great. So that pretty much clinched the diagnosis that as soon as he got back home, the pain starts up again. Is he in a stressful environment when he's back home? You bet he is. Yeah.
And that's a big key for people to also know is if you're going to work and you're completely different, you're in pain, not just like emotionally or whatever you're dealing with, but it's causing you physical pain from that. And then you can get away from it and you're not in pain, like then maybe you need a different job environment.
Yeah, or that there's something going on there that is triggering for you. Many of my patients who experienced adversity as children, there is something in their life today that is connected to or reminds them of the stress they went through in the past. One example was that a colleague of mine shared was a man who's poorly treated by his dad growing up. And then all of a sudden he had a new boss in his workplace who treated him poorly in a very similar way. And it just kind of brought back all of the bad memories from the past and was highly, highly stressful, as you might imagine. And it manifested in him physically.
Yeah. And so when you have those physical pains, especially if you go to your primary physician because, you've started to deal with this and you're like, okay, enough's enough, whether it's your own doing or your spouse saying, would you go to the doctor? Like that you actually go and if they can't find something, like for most, that should be a trigger for all of us to go, okay, I need to go talk to somebody about my emotions or what I'm thinking, to not just to the physical doctor, but to somebody who can help with the psychiatry side of it. Right.
Yes, that's a very good plan. If the doctor is focused on the part of your body that has the symptom, and it's not always pain. I mean, I've had lots of patients with dizziness or ringing in the ears or visual disturbances or trouble swallowing or bowel difficulties or nausea. I mean, there's a long list of non-pain symptoms that can do this as well. But if the doctor can't find a biomedical explanation, a disease or an injury, then almost certainly the pain is generated by the brain. Something like 40% of everybody who goes to the doctor to get a symptom checked out, it turns out to be this brain generated or psychophysiologic symptom that's causing it. If the doctor is doing their diagnostic tests and they don't find anything, then the probability goes way up from 40%. And then sometimes the doctor will find something and they will attribute your symptoms to that something, whatever it is.
Right.
This is common in the low back, for example. Most people over the age of 40 have some minor abnormalities in their lumbar spine. And it's easy for the doctor to say, oh, you've got these abnormalities, you've got pain. It must be the one is causing the other. Well, it turns out that if you do X-rays or MRIs of the lumbar spine in people over the age of 40 who are in no pain, whose backs feel perfectly fine, they have those abnormalities just as often. So it's not necessarily true that the abnormalities are responsible for the pain. But if they feel like they might be, and they do some treatment based on that, and the treatment doesn't work as they expect it to, then you need to think also about whether the symptom could be brain generated and start looking around for past or present stresses that could be responsible. And that's, again, where that 12-item questionnaire on our website, endchronicpain.org, can be helpful.
And so speaking of the lower back, as you're talking about that, I'm just thinking, okay, well, if there's stress that the brain is trying to overcome and can't, and so it's starting to show symptoms and pain, and is there a commonality between, like, where is it most commonly going to occur, or is it anywhere?
Yeah, it's amazing that the symptoms can be head to toe. Migraines, fibromyalgia, which is widespread muscle pain, a condition called complex regional pain syndrome, which is usually in the feet or the hands, and can even lead to physical color changes in the skin of those areas. Irritable bowel, pain in the female pelvis, genital symptoms, bladder spasms. Even certain kinds of rashes can develop. The only common denominator is that many of my patients have tended to have more than one symptom at a time. Not infrequently symptoms that are, separated from each other. Somebody with low back pain and fibromyalgia, or pelvic pain and fibromyalgia, or migraines and irritable bowel syndrome, things that are not directly connected to each other physically, but they are absolutely connected through the brain.
Right. And so is that because of the way the nerve network works in the brain? And so if a doctor was to hear, okay, I've got these two symptoms that shouldn't be related whatsoever on a physical side, is it coming from a common place in the brain, or is it just because the nerves in the brain themselves are just being,
Yeah,
hijacked?
the studies are still going on there, but it does turn out that there are a number of different changes in the circuits in the brain that are connected to the generation of these symptoms. All of the causes and effect linkages in the chain haven't been completely worked out scientifically yet. We're still in the early stages of understanding the precise nature of the physiology, but it's clear that the brain is responsible, because the condition can heal just by talking to somebody, like that first patient that I mentioned. If we can identify the stresses, we can understand where those stresses came from, and we can apply treatment. We can physically change the level of stress that's happening to somebody. The simplest example was a patient of mine who only got his symptoms when he was driving to work. When he was driving home from work, he was fine. On the weekends, when he was not at work, no problem. So obviously I followed up and say, well, what's going on at work? And in his case, it turned out that right before his symptoms began, he was in a 2-person office in a large corporation. His partner was transferred 1,500 miles away, close to where you are, in fact, in Texas. And all of a sudden, when that happened, of course, his workload doubles because his partner is gone. And they had trouble hiring a replacement. So the months go by, and, he's really struggling to keep up. So it manifested in his body. But that was, just in his case, even though I couldn't hire a replacement for his partner for him,
Right.
just knowing what was going on, just being consciously aware that, yes, you are under a ton of stress, that you hadn't really connected with your stomach before,
Right.
that helped him tremendously.
And so for somebody like that, or anybody that is going through it and going, okay, well, we're going to go talk about our feelings. We're going to dig into this. We're going to release the stress. You mentioned like the brain shows differently when you looked at through the functional MRI. Are we doing tests on those people, a year later, 2 years later, when they're no longer seeing symptoms, to see, is the brain recovering?
Yes, we
happening?
have two studies that show that. The simplest one was from about 20 years ago, and it was just a single patient with irritable bowel syndrome. And after she got psychotherapy, they scanned her brain again, and lo and behold, the changes they had seen in the brain had reversed back to a normal pattern. But that was just one patient. So
Sure.
more recently, study published in 2021, September, in the Journal of the American Medical Association, was 150 patients with back pain for an average of 10 years. And there were two groups that got, control groups. One got their usual doctor's care. Another one got injections into the spine. But the third group got one of the new forms of pain relief psychotherapy. And it turned out that those patients, their pain scores plummeted. I mean, with just a month of treatment. Wow. These are people with 10 years of back pain, just a month of pain relief psychotherapy, and their pain scores dropped to an average of 1 from, over 4. 2/3 of them got, I believe, all the way down to 0 after 10 years with just 1 month of therapy. I mean, this was absolutely groundbreaking research. Yeah. But to answer your original question, yes, their brains changed. They scanned them before and after. And just with this talk therapy, brain anatomy was shifted to a healthier pattern.
That's amazing. I mean, it really is. And
it shocked people.
And it shows that how much the brain, yes, but also like the body as a whole, how much that if we just take care of ourselves and treat ourselves, and the body will heal itself if we take the triggers out of the way.
Yes, the challenge is that, which has been a challenge for patients and also for the medical profession, is that the stresses that are doing this are sometimes not easy to find.
Right.
They are, unconscious. You have to know what to look for. Right. And, one of the questions that I ask people is, particularly about the childhood adversity, is, imagine you are a butterfly on the wall of your childhood home, and you are watching your own kid or a child that you care about, if you don't have any kids of your own. You are watching that child try to cope with exactly the same environment that you grew up in. And you're this butterfly on the wall for, let's say, just a week or 10 days, watching that kid try to cope. And how is that going to be for you? Are you going to be okay with it? Are you going to be happy to watch your kid playing in this environment? Or are you going to be progressively sad or angry watching that kid try to cope? And the reason that exercise is important is that none of us has a parallel life to compare ourselves with. So many of my patients, when they look back, they're not recognizing how things really were. It's only when they imagine their own kid trying to cope with those issues that they begin to see the reality of it and just how difficult it truly was. And then the emotions start to become easier to recognize. Let's put it that way.
Right. Well, and I'm the second of 5 kids, and not to get too personal with sharing their sides of, my siblings' sides of our childhood. But I remember as an adult now, we've had conversations, and sometimes we're like, one of my siblings will say something, and one or two of us will go, "We don't remember our childhood like that at all. What are you talking about? Like, it wasn't that way." And that just shows like it is so personal to you. And so if you've got family members, especially that are saying, oh, it wasn't that bad. Why are you dealing with this that way? Like, not to take that, like, not to feel bad about that. And like, if you felt that way, you felt that way.
Yes, and when I hear patients tell me all the time it wasn't that bad. Other
Mm-hmm.
people have been through much worse than I have, and they seem to
Right.
be okay. I think I've recovered from that. I've left that in the past, and that's when I ask them, okay, well, if it really wasn't that bad, would you be all right with it if your own kid was growing up in the same place
Yeah.
and you had to watch it and you couldn't do anything about it? You just had to watch it happen for a week or so. And very, very often when I put it to people that way, their facial expressions change.
Mm-hmm.
They look shocked, and they realize that they wouldn't want their kid in that environment for
Yeah.
5 minutes, let alone 5 days.
Right.
And I would say the same thing to anybody's sibling who's saying it really wasn't that bad, or I think it was okay, and ask them to think about their own kid growing up in that same place.
Right.
One of my patients, I remember I asked her to do that experiment, and she had been telling me, for the past 15 minutes that things were not that bad. But when I asked her to imagine her own kid in the environment she grew up in, and that she had to watch that happen for a week,
Yeah.
she just stared at me for a couple of minutes. And then finally, at the end, she said, at the end of that week, I would shoot myself.
Oh my gosh.
Complete reversal of her opinion of what things had been like.
Right. Well, that's what I think is funny, is that a lot of us, we sugarcoat things a little bit, and because we want to get rid of the negative side of it, and so we sugarcoat. But if it's our personal, like, we're down on ourselves and self-doubt, and we're hard on ourselves, of like, we remember all the negative things that we did. But when we're in those environments, it's like we just want to remember the good things.
And we don't have anything really to compare it to. We didn't grow up in a different home environment that was maybe healthier or less dysfunctional or less adverse for us, that we can compare it with.
Right.
If we had the chance to grow up all over again in a healthier environment, we could see the differences.
Yeah. And so when we're talking about physicians, is that what you're doing with the Psychophysiologic Disorders Association, is trying to help physicians understand there's this whole other avenue of care that needs to be researched with these patients?
Yeah, we want to help everybody. We want to help physicians. We want to help mental health professionals, because the best outcomes occur when a mental health professional and a medical professional collaborate with each other. Right. Patients with pain or illness, they go to their physician to get checked out. If the physician knows that the brain is capable of generating symptoms, and does that in 40% of the people who come through their door, and they know how to investigate a little bit for that, and they uncover some of the issues we've been talking about today, then ideally they would have a mental health professional who could take over at that point, and a mental health professional that also understands the kinds of issues that can make people physically ill, because it's usually not part of their training. They focus on the mental health side. When it comes to pain or illness, it's not something they're as comfortable with. So my organization is dedicated to helping everybody in the healthcare profession, medical or mental health, to understand these issues. Because when they work together, the outcomes can be extraordinary. One of my patients was ill for 79 years with this, and even that woman made excellent progress.
Yeah. So is this something that then, I mean, if from a statistic standpoint, if it's 40% of people they're complaining about symptoms and coming through their door, and is it 1 in 6 adults that suffer from chronic pain?
1 in 5, 1 in 6, something like that. If you combine not only the chronic pain, but the non-pain symptoms as well, it's probably 1 in 5, 50 million people in the United States.
So is this something that, and some of us maybe one day hitting that trigger that then sends us into a chronic pain issue, right? It's because it's underneath the surface, and we've pushed it down, and
Yeah,
we just haven't dealt with it yet.
this doesn't happen to people who are neurotic or who can't handle their stress. I mean, this can happen to anybody.
Yeah.
My patients, if anything, they are mentally stronger than average.
Yeah.
But they are like Olympic weightlifters who are given 50 pounds more than the world record for their weight class to carry around. Yeah. And, if you do that, even to a world champion, their body is going to break down. They're going to feel weak. They're going to feel like they can't handle their stuff.
Yeah.
That's what my patients are like. They are as strong as anybody. They have just been handed by life a load that none of us could be expected to carry.
So is it something that, like, is for those of us that are brought up in an understanding family that, like, has a, you go to the dentist, you go to the eye doctor, you go to your family care physician, women go to the OB-GYN, like, is this now, like, we should be adding in that mental health professional ahead of time to sort of like set the baseline so that if something does trigger, we can go, we already established a relationship with this person, we've trust them. Is that something that people that should start looking at as a part of their, like, team of healthcare?
Yeah, absolutely. I mean, I've been a member of an organization called the Collaborative Family Healthcare Association, and that is their whole mantra, is to combine primary care medical clinicians with behavioral health consultants in the same office at the same time, so that when these issues are identified, they have their behavioral health person or their mental health person right there in the office. They can come in and see the patient as part of their primary care visit, which is absolutely the way it should be. Yeah. And that's the way you get the best outcomes. I've been teaching at their annual conferences every year since 2009, and it's been very well received.
And so that just made me think of a question, is when it comes to that kind of therapy and treatment, is there a difference between face-to-face versus, a video conferencing for somebody to get that therapy? If somebody is at a place where I can't get to the office because it's so difficult.
Yeah, and you don't even necessarily need to have a lot of contact with a human being. There are books available now, including my own. My first one was called "They Can't Find Anything Wrong." The second one that I wrote with several others is called "Psychophysiologic Disorders." And the first one is written at a fairly popular level for patients. The second one is more scientific, but there are a lot of people that love to read about the science, so that's a good one for them too. Yeah. And this being the 21st century, there's an app called Curable, which is very effective. The people who founded it took all the best ideas from my colleagues and myself and put it into a wonderful user interface, and they charge for it about what you'd pay for a half-hour session with a psychotherapist, and you get a full year of access to it. It's very effective. It's got most of the ideas that I've been talking about with you today are incorporated into it.
That's awesome. And so how can we, somebody listening or myself or anybody, how can we help you with your association as far as, like, what can we do to spread the news or help?
Yeah, we would love it if people became members. We, charge a nominal amount for people to become members, and we pretty much give that back to our members in the form of discounts to the resources that we have. We have conferences that are recorded. We have an online webinar course. We have an online written chapter course is there. We offer monthly question and answer webinars around the world for our members to join in, and they can get their personal questions answered. And to bring this information to your physician. If you take advantage of the resources that we provide and you find that your physical symptoms have improved as a result of that, to let your physician know that this is something that you found that was valuable.
Yeah. That's awesome. And so what's the website that people can go to?
The easiest URL to remember is endchronicpain.org. And we just run all those three words together, endchronicpain as one word, .org. And you can get access to that 12-item questionnaire to screen yourself. And then there's a number of recorded interviews with patients who have been through this journey from the very dark past of severe symptoms to the light of recovery from those conditions. And then we've got lots of information about common forms of psychophysiologic disorders and evidence-based, science-based resources. We don't, the ideas that we promote have been published in recognized scientific journals. There's even a bibliography with over 200 scientific references that back up the ideas that we recommend.
Nice. So, I want to be conscious of your time, and I want to thank you for being a guest. Is there anything else that you would want to share with listeners when it comes to, if they're dealing with this, what they should be doing? Well,
I would certainly say that there is hope for this. If people, so many of my patients are in utter despair. Right. That book I mentioned, my first book, They Can't Find Anything Wrong. The very first story in that book is a patient who was hospitalized at a major university on the West Coast 60 times in 15 years. She was in such despair that she basically said, "Doctor, don't waste your time with me." She happened to have one of her attacks when she was in Portland. And she said, "Don't waste your time. You'd be better off seeing your other patients." Because, as you can imagine, she'd had every test in the book. She'd seen a dozen specialists. The psychiatrist couldn't find anything wrong with her. And yet, less than an hour later, we had a confirmed diagnosis, and she was cured on the spot. I don't get those kind of outcomes with everybody. I don't want to mislead anybody, but it shows you what is possible. And it definitely shows you that even for a patient like that, there's tremendous hope.
Yeah. Well, that's awesome. And I commend you for the work that you're doing. And I will stand behind you and help wherever I can, because I've had people on before, and they're personal friends that I know are dealing with this, and I know that they struggle with it, and that it is hard to have hope every day when you're going through this. But I know, just like you've mentioned, that if you can figure out where the trigger is, then things can get better.
Yeah, I've treated more than 7,000 patients for this over the last 40 years. And it's tremendously rewarding work as a professional, and very definitely rewarding for the patients who've been through this process. And I appreciate your support today. Means a lot.
Of course. Well, thank you, Dr. Clarke, for being a guest.
Thank you.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.